Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 10, Episode 2 of the Function with Purpose podcast. Thank you guys for joining in. This is Dr. Amy here with you today on this lovely day. Maybe you're driving in your car with your favorite coffee in hand. It's in the morning. The sun is coming up. That's actually my favorite time of day. The morning, sunrise, coffee in hand. Maybe not driving a car, but being outside. Right now it's still the cold. But, anywho, okay, off topic. Today's title and focus. What physical therapy or physiotherapy really does for you. What does physical therapy really do? So I have my computer in front of me. I'm going to give you some Dr. Google searches. These are just quick ones, and then when I click on them, this is what it says. So I typed in "what is physical therapy" in the Google search bar, and this one, just a quick snippet, this is what comes up as a subject line. From the National Institute of Health, NIH, that's a very common website. Physical therapy, also known as physiotherapy, may include certain exercises, massages, and treatments based on physical stimuli, i.e. heat. Another one, from the Cleveland Clinic, a very another well-known website that typically the public uses. Physical therapist. Definition, expertise, and specialties. A physical therapist is a healthcare provider who helps you improve how your body performs physical movements. They'll help you manage symptoms. And then this last one, as a great example too, actually comes from our American Physical Therapy Association. So this is an association that you can or cannot have a membership to. Of course, you have to pay dues if you want to be a member. Physical therapists are licensed doctors who work with multiple patient populations impacted by disease, injury, and movement dysfunction. Wow, that's actually pretty well-rounded. So this is just a basic search. When you go to the Google search and type in, what is physical therapy? Oh, wait, here's another one, last one. I don't know if I said this. From WebMD, another trusted website. When I type in what is physical therapy, it says physical therapy exercises, manual, massage, heat or cold therapy, warm water therapy, or ultrasound to ease muscle pain or spasms. Rehab to help you learn to use an artificial limb. That's from WebMD. All right, let me read again. This is going to be a long episode, which you know already, based on Season 10, Episode 1. Let me go back to the APTA, or the American Physical Therapy Association. Physical therapists are licensed doctors who work with multiple patient populations impacted by disease, injury, and movement dysfunction. Okay? So here's my thought. What does physical therapy really do for you? What does it do? Here's what I think. I think us as a physical therapy profession, or as the physical therapist professional, we do not do a good job informing the public on what we can do for them. We can't, and it's very difficult to paint a solid picture for you, the consumer, to understand what PT, aka physiotherapy, physical therapy, can really do for you. Unfortunately, the public perceives physical therapy as some of these previous definitions I mentioned from the NIH, WebMD, to massage pain away, to put some ice or heat on the muscle spasm. But when you look at the APTA, or our Physical Therapy Association website, we are doctors who work with patients who are impaired by disease, movement issues, injury, activities of daily living. You can't fulfill your societal role. Physical therapy has more layers. Physical therapy doesn't massage the skin or the muscle. You're laying on the table and we're gonna massage the pain away. And that you lay there in a hot pack, put some E-stem on it. I hope you're giggling a little bit. So I'm going to click in from my computer on our APTA website. They do a pretty good job. But from my perspective, physical therapy has more layers. Yes, there's multiple types of physical therapy in different settings, i.e. the hospital. Maybe someone is coming fresh out of a heart implant surgery, and they are in the ICU. A physical therapist will come in and assess them. They will assess their vitals. They will take their blood pressure. They will assess their IV drip monitor that monitors their heart rate, their blood pressure, their O2 stat. Are their ankle pump compression stockings still on? Are they working? Is the patient responsive to verbal communication? Can they move their arms in bed? They're going to assess their arm. They're going to get them sitting up at the edge of the bed for a little bit. That's physical therapy in that type of scenario. If someone's in the ICU, maybe they're laying down in the bed, and the goal is to get them to sit up in the recliner chair safely so they can eat their food. Physical therapy, it's called physical for a reason. There has to be some type of physicality to this. Therapy-wise, I like to just think of it as we need to dim things down a little bit. We got to create a lower threshold environment. We need to calm down. Therapy itself should not hurt. Therapy doesn't hurt. Therapy makes you better, right? And then there's another scenario of what physical therapy or physiotherapy can do for someone. And I'm going to use me as an example, Fortress Physical Therapy. Yes, I work with individuals who are pretty active, very active. They want to change their health metrics. They want to get off that blood pressure medicine. They want to lose body fat and improve their fitness levels. But from time to time, they experience a setback. Maybe they developed a pain in their lower back, and perhaps there's symptoms going down to their leg. and it's hard for them to walk. And it's hard for them to sit in a chair and do their work duties at the computer, yet alone making it to the gym and trying to sit on the stationary bike, because they still want to make fitness a part of their routine. Right? So I have to come in and step in, help mitigate the issue and teach them and educate them that, hey, you're in control. I'm just going to help guide you. We got to make sure this experience of back pain and perhaps symptoms of pain or numbness, tingling in your leg isn't too serious for you to seek out medical attention. Because 8-9 times out of 10, something like that happens, can totally be mitigated through physiotherapy. You don't need to go get an image. You don't need to go get steroid injections and all of the over-the-counter prescription medicine. Physical therapy can certainly assess that. Then, based on that assessment, do we need to walk down that path? But we still need to make fitness a part of your recovery process. So that is like basically one extreme to the other. Someone's in the ICU, they're recovering from maybe a heart implant, and the goal for them as the physical therapist, they come in and assess, is to get them from the semi-reclined position or a little bit, from laying down on their back to sitting up on the edge of the bed or into the recliner so they can try to eat their food or drink their liquid. To what I do, what Fortress does. I help keep people in the game. I help people recognize that they need to constantly improve their health metrics, their health, wellness, not wealth. Well, we all need to improve wealth, but wellness, health, wellness, fitness, and recovery, blending all of those together, making the body more robust, right? So I'm going to get back to this. Oh man, I haven't really looked at this, but the APTA, American Physical Therapy Association, apta.org. I'll hyperlink this in the show notes. But this is a organization that I'm a part of. It's not required to be a part of this, but you kind of pay your membership dues every year, and then you can go to a conference and you get discounts on conferences, whatever. But let me just read you this definition from the APTA, and they've definitely refined this several times. I remember looking back at this like 10 years ago, and it was just like, really? It was like what I was mentioning before, hot packs, lay on the table, let me stretch you. No. Hear me out. Physical therapists are licensed doctors who work with multiple patient populations impacted by disease, injury, and movement dysfunctions or issues. They help optimize quality of life by maintaining, restoring, and improving patients' ability to move, function, and live more active lifestyles. Fun fact here. The outlook for a career as a physical therapist is strong. The U.S. News and World Report listed physical therapists as the number 3 best job in healthcare and the number 6 overall, based on number and percentage of projected openings from 2021 to 2031, as determined by the U.S. Bureau of Labor Statistics. That's interesting. I didn't know that. And then it goes on to kind of like, where do PTs work and how much do physical therapists earn, which it says almost $100,000. I don't know where the hell they're working, but anywho, that's not true for me. But and I'm fine, and I'm making a nice salary that I can totally live off of and be minimalist. Yeah, I think kind of like the definition of physical therapy, physical therapists, the APTA really nails that down, right? So, physical therapy has deeper layers deeper layers to the point of what I do and try to instill that into my patient's mindset, right? I'm going into 11 years of experience in this field, and going into 6 years of working for myself. And, there's so many misconceptions on, oh, well, I'm only going to physical therapy because my doctor told me to, or I'm recovering from surgery, or, I sprained my ankle, or maybe I kind of tweaked or tore my rotator cuff, or I need to go because my insurance takes 20 visits a year and I might as well just use them or whatever. Right? No. Yeah, that's a little bit, but that's only the first layer of what physical therapy is. We need to peel back those layers. We need to, no matter what stage you are in perhaps your healing process or your pathway to life pursuits, do you have a fitness component to it? Do you understand how to improve your wellness? What are you doing each day for your wellness in order to change your health? How's your sleep? How's your eating? Are you getting daily movement? Are you walking more? Are you building strength? Are you adding some type of movement or flexibility routine throughout your day? All right, because we're a culture that sits in front of a desk all day for 8 hours, and then we go try to hit the gym and hit it hard. Something happens, you have a setback, then what do? You maybe go to the medical doctor, maybe get some medicine that you have to ingest, and it goes through your liver, which then goes into your bloodstream, when we can probably bypass that whole thing and maybe seek out professional help. Physical therapy can be that connection point. Physical therapy can bridge that. Physical, right? The physicality, how well do you move? What's your daily routine like? How's your sleep pattern? How much movement do you really get into your elbow joint, your shoulder joint, your neck, your back, your lower back, your hip, your knee, your ankles? Are you exploring and expanding your movement library, your movement alphabet? Because when you're sitting at a desk all day, your hips and your joints and your tissue only know that specific motion. And then you try to go to the gym and hit it hard. Physical therapy can help expose those deeper layers, can help you instill better wellness practices. Maybe you are lacking some shoulder overhead motion. Well, hey, a physical therapist can assess that, help you realize that, hey, maybe we need to do this specific movement in order to improve your overhead reaching. And then when we improve your overhead reaching and you gain new access to range of motion that's been hiding out, then we strengthen the tissue. Then we load it. Then we get you involved with fitness even more. Maybe you finally go into that free trial CrossFit class. You try it out. Do you like it? How's the environment? How's the atmosphere? How's the coaches? How are the people around you? Do you connect with others? And I love this. This is going to lead to me taking some classes back in 2023 through, shout out to Ice Physio, that Dr. Jeff Moore, who founded that. PT is more. You have to #be about it. And I really connected with that. Be about it. It is up to us the physical therapy profession, the physical therapists, to help expose the public that there's more. There's more than, hey, I got surgery, now I have to go to physical therapy. Hey, I have this neck pain, but I saw my physician first, and then he prescribed me a prescription drug to take, and then he said I need to go to a pain doctor, and then I need to get an MRI, then I need to come to physical therapy, making physical therapy the last resort, when it should be all that other stuff that I just named, the last resort. Us physical therapists need to start being about it and leading in the front. And that's one of the main reasons why I started this podcast. So if you're this far along, thanks for listening to me. This is what I do. This is what I love. I love helping people realize that there's more. There's more to what they can do. There's more to what physical therapy can help along the process. There's more that keeping and maintaining physical therapy a part of your lifestyle. We need to expose more truth to this. And we are licensed doctors. We are licensed doctors of physical therapy. We help the public maintain their societal role, meaning your job duties, perhaps as a parent, as an employee, as an employer, a friend, a sibling, partner, husband, wife, athlete, coach. It's more. It's more than the superficial layer of stretching the patient on the table, massaging the pain out of the leg, stationary biking for 10 minutes so I can get a unit of check. We have to be about it. We have to not necessarily accommodate to our environment, our ever-changing environment, but an indirect way to accommodate the ever-changing environment is to accommodate yourself, to improve yourself, to improve your wellness practices, which then changes your health metrics by sprinkling in and maintaining fitness. Being more aware of what's your baseline blood pressure, what's your baseline heart rate, how's your sleep, are you getting enough protein, are you drinking enough water, are you getting outside, are you getting morning sunlight, all of that. It's more. It's more. And perhaps maybe you know someone who is on the other side of the spectrum in the ICU, and then their next step, they go to inpatient rehab, and they're in 3 hours of rehab a day, i.e. physical therapy, occupational therapy, speech therapy. And then they're able to go to a skilled nursing facility, and then they go home and they get discharged home for home health physical therapy. And then they're getting better, and then they go to outpatient physical therapy. And then what happens after that? What happens after outpatient physical therapy? They go home, and then, they return to their societal role, and that's it. There's something else. They're missing it. You still can continue physical therapy. Now you're going to see more of these clinics like myself, like Fortress Physical Therapy, a standalone private practice, cash-based physical therapy clinic, who is in a gym, which I'm located within CrossFit Pineville, that we start bringing fitness to the forefront. Because I don't want you going back to the ICU. I don't want you going back to the rehab facility. I don't want you going back to skilled nursing facility. I want you to maintain your societal role in expanding your health and fitness and your lifespan, right? Oh, that is deep. I don't know about you. Go ahead and take your sip of coffee. Yeah. Physical therapy can really be that connection point for you. But we need to try to change that perception. And then hopefully you guys are listening to this. You can totally share this episode with your friends and family. Physical therapy can bridge that gap. And that's what I'm about it. I'm being about it. Be about it. I want to keep making people feel better, strong, confident, robust, resilient. Because we don't stop at the ceiling. We have to move the ceiling higher and higher. So thank you to Jeff Moore, Ice Physio team. #BeAboutIt. And thanks for the listen. Pursuit, precision, purpose. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.